So normally I would knock on the door and wait for the patient to tell me to enter. Once I've entered the room, I would use hand sanitizer to clean my hands, and then I would continue. So hi, my name is Hillary Jordan. I am a student nurse at the University of South Alabama, and I am here today to do your musculoskeletal assessment, if that's okay with you.
Yes.
Okay, so first I'm going to start off with inspection of palpation. So I'm going to lift your gown, if that's okay.
Yes.
So what I'm looking at right now is your knee. So I'm checking and making sure there's no cyanosis. I don't see any swelling, or actually there's no cyanosis. I don't see any bruises. It's a light, her skin is pale. They're equal bilaterally. I also don't see any swelling, masses, or deformities. Do you mind if I touch your knees?
Yes.
Okay. So when I palpated her knees, I didn't feel any masses. There was no swelling. I didn't see any deformities. It was warm and equal bilaterally. So now I'm going to move on and test your muscle strength. So if you put your arms like this for me, so I'm going to pull outwards and you're going to push towards you. Okay, and now I'm going to push in towards you and you're going to push out towards me. Alrighty, good. So for her upper extremities, I would give it a 5 out of 5 for the scaling. So now we're going to move on to your legs. So I'm going to put my hands on your thighs and you're going to push up with your legs. Okay, good. So now I'm going to push your legs in towards the chair. You're going to push them out towards me. And now we're going to do the opposite. So I'm going to push out towards me. You're going to push in towards the chair. Okay, so overall her lower extremities is a 5 out of 5. So overall her muscle strength of legs and arms is grade 5, which indicates that the range of motion indicates range of motion against full resistance. So moving on, we're going to test your acting range of motion. So if you would stand up for me, I'm going to push your chair back just a little bit. So we're going to start off with your TMJ. So we're going to open your mouth, protrude your jaw, move it side to side. Okay, good. So now we're going to do your neck. So we're going to start off by flexion. So you're going to put your chin to your chest. Okay, then we're going to do extension. Then we're going to do hyperextension. So you're going to look up to the ceiling. Okay, good. And now we're going to do the lateral bend. So you're going to keep your shoulders where they are and then bend your ears towards your shoulders. Okay, do the same with the other. Now we're going to look in different directions. So you're going to look over towards the CV. Okay, good. Now we're going to look over towards the wall. Okay, good. So now that we are done with your neck, we're going to move on to your shoulders. So we're going to put your arms out with your elbows straight. Okay, good. Then we're going to put them, this is for flexion. So now we're going to put them back to sides for extension. Or you just go straight down. I'm sorry. I was doing that so I didn't hit your hands. Okay, and then we're going to do hyperextensions and we're going to go behind. Now we're going to go wide, do a wide arc above the head for abduction. And then come back to your sides for adduction. Now we're going to do internal rotation. So you bring your hands towards your scapula. Okay, we'll check that, make sure that they're where they're supposed to be. Okay, good. Now we're going to do external rotation. So you're going to put your hands to the back of your head. Okay, that's good. So now we are going to check for your elbows. So we're going to bend it for flexion. We're going to straighten them for extension. Okay, we're going to pronate, so we're going to put them down, and we're going to supinate, so we're going to put them up. Okay, good. Now we're going to go on to your wrist and hands. So we're going to bend your wrist for flexion. Then we're going to put them straight out for extension. They go all the way up for hyperextension. Now we're going to do your fingers. So for flexion, you're going to go down, you're going to go out for extension, and then for hyperextension, you're going to bring them up. Okay, now we're going to take each finger and go to the base of your, take your thumb and put them towards the tips of your fingers. So 1, 2, 3, 4. Okay, that's good. And now we're going to take your thumb and go to the base of your pinkies. Okay, good. So now that we have done that, we are going to check the hip. So we're going to flex. So you're going to put, you can use the chair if you want for balance, if you need it. So we're going to flex. So we're going to put it out. That's flexion. Then we're going to straighten it back down for extension. Then we are going to do flexion. Then we're going to come back in. We are also going to do internal rotation, or external rotation, I'm sorry, and then internal. Okay, and earlier when I was doing your wrist and hands, I forgot to do the deviation. So we would do radial deviation, so you would go in, and then we would do ulnar deviation, which would go out, and then we would do abduction, and then adduction. Okay, good. So now that I fixed that, we're going to go to your knee. So we're going to bend it for flexion. We're going to straighten it for extension. Okay, that's good. So now that we're done with that, we are going to move on towards your ankle and your foot. So you're going to put your toes towards the floor for flexion and straight for extension. Okay, then we're going to go up for hyperextension. Okay, then you're going to take your sides of your soles outwards for inversion, then inwards for inversion. Curl your toes for flexion and straighten them out for extension. Okay, so there's full range of motion. I didn't notice any audible crepitation. So now we're going to move on to the active range of motion for your spine. So if you would bend over and touch your toes for me for flexion. Okay, now we're going to stand up for extension. We are going to bend sideways for lateral. Okay, bend sideways. Then we are going to twist your shoulders without moving your hips. Okay. And earlier I forgot hyperextension, so we're going to bend backwards 30 degrees. Okay, that looks good to me. So now if I can get you to turn around, I'm going to expose your back and check your spine. And so I would also say that there was no crepitation audible in any of the joints, or did you feel any pain or tenderness?
No.
Okay, so there's no pain or tenderness in any of them either. So while I'm looking at her spine, I'm going to look from the neck to the gluteal cleft and make sure that the spine is even, that the shoulders and the scapula and the iliac crest are all even as well. So I'm going to check the 3 curvatures. So I'm going to get you to turn this way so I can see them a little better. So the cervical should be concave, then the thoracic should be convex, and then the lumbar should be concaved as well, which it does look like they are. So the next thing I'm going to do is check you for scoliosis. So if you could turn back around this way, I'm going to have you bend over, please, at the waist. So I'm looking for the elevation of her shoulders, which they're even. Her scapula is even along with her iliac crest, and her spine is centered and does not deviate any. So that means that there is no signs of scoliosis. So if you stand up for me, please. Okay. And that concludes our musculoskeletal assessment for today. Thank you.